This is the technique I'm telling you. This is the one of the best technique I can ever execute it while still I started doing knee replacement surgeries. Because stitchless surgeries or stapleless surgery is that because you are doing everything in one go. Patient needed to come another time to go for the stitchless or to remove the stitches or staples. Another thing is that the executions is technically a bit demanding, but it is easy. Stitchless, stapleless surgery is possible only when we are not using tourniquet. Tourniquet is that we are not stopping the blood supply to the knees. We are not putting anything. We are not restricting the blood supply. This is the beautiful conditions when the patient can start walking in the same day. If you are doing with tourniquet and you are doing the stitchless surgery, then it could be a disaster. Only it can execute it without tourniquet. That is the best case you can execute these stitchless or stapleless surgeries, where the recovery is very fast. Patient is mentally very motivated when after 3 or 4 days when he see his or her knees, then patient really elated to see there is no stitch or no staples. Other thing is that they needed to come another time, another for the surgery for removing any of the things. So there is no fear. Another thing is that a patient can have bathing after, can have naha sakte. They can have bath after 3 or 4 days. It is very easy. We can put some waterproof dressings and they can have easily everything after 3 or 4 days. They can have bath. Even in the month of May or June when there is a humidity is there.